All right, so we sort of stopped right here. We talked about those three sets right here. We just reviewed mineralocorticoids, glucocorticoids, and the sex steroids. Those are the three major categories or types of hormones that are made where? The adrenal cortex. And I remember adrenal cortex, cortisol, like the quartz, right? Cortex, they're coming from right here. We'll talk about the medulla in just a second. So these are really important because they affect your salt and water balance, your sugar metabolism, and have some endocrine steroid function on your overall body and your reproductive system. Okay, so those are the main ones that we talked about last time. So now switching over to the medulla. So if we look at the actual core, these are specialized little glandular cells, chromaffin cells, or big fat cells, and their whole job is to make a couple different hormones, and that's epinephrine and norepinephrine, and I just abbreviated those. So epinephrine, also known as adrenaline, norepinephrine, known as noradrenaline. So these are activated with the sympathetic nervous system. So we don't go all into the nervous system in here, it's pretty complicated, but you have your central nervous system is your brain and your spinal cord, and then you have your peripheral nervous system, all the nerves that exit your brain and exit your spinal cord, and they serve all the parts of your body. Your sympathetic nervous system is your fight or flight, a branch of the fight or flight part of your nervous system. So your brain and your hypothalamus kind of activate nerves that go throughout your body. And in this case, this is kind of the fight or flight component. We have the parasympathetic nervous system, and I'll just write that here. We don't go into this a whole lot. We'll talk more about stress at the end of the course, and we'll talk more about parasympathetic nervous system versus the sympathetic nervous system. Those two are kind of your rest and digest. This is when you're cool, you're mellow, you're chilling, you're just taking notes, relaxing, eating, drinking, going potty, all those normal basic functions. Your parasympathetic control is sort of activated, okay? Your fight or flight is the sympathetic nervous system. If you were to get stressed or start thinking about something or hear a really loud noise or something catches you off guard or they have any kind of traumatic anything happen, the sympathetic nervous system will get engaged and will get activated. So the brain and the spinal cord and the nerves will go down and they will activate organs like this, the adrenal medulla. There's nerves that come down from your spinal cord and from your brain, and they actually say, okay, release, start dumping out norepinephrine and epinephrine. Mostly norepinephrine, okay? So the adrenal hormones, the adrenaline, that's where the name comes from. Adrenal medulla, adrenaline, noradrenaline, okay? So norepinephrine and epinephrine, these actually get released from the adrenal medulla in part of that sympathetic nervous system response. But notice now they're going to be dumped and they're going to be carried in, I'll use a red to show that they get carried by the capillaries and blood vessels of your body. So there are blood vessels all nearby that pick up the norepinephrine that's released from your adrenal medulla. So now they get carried in the blood all throughout your body. So you have hormones like norepinephrine circulating through your bloodstream, okay? So norepinephrine does a bunch of different things on your body. In addition to the sympathetic nervous response, where you're activating all these things in your body, you're breathing quicker, your heart rate speeds up. Maybe I should ask you guys, what happens when you're really nervous, you're really stressed? What are the things that you notice in your body? Some things are real obvious right away. Sweaty. You sweat. I sweat all the time. I don't even have to be nervous. But sweating, profuse sweating, usually you're like, you're getting really hot. You get antsy. So fidgety, skeletal muscles sort of activated, fidgety, hard to sit still. What else? Your vision is what, Bobby?
Like, it can be like blurry or splashy.
That's true. Your vision can get spotty. That in general, that happens. Also, what happens, and you may not realize this so much, but your pupil actually dilates. So if you're real stressed and I can look at a light in your eye, just not shine it directly, but I can see the pupils will actually open up, they will dilate. Because your body is attempting to get more light to the back of your retina so you can see more clearly. However, if you're super nervous and you're getting flushed and you're getting hot and there's blood pumping, sometimes you do get this body for like feeling like you're gonna pass out sort of. That is sort of on the other extreme. So retina actually gets more light, the pupil dilates. What happens to your heart rate?
Goes up.
Heart rate goes up. What happens to your respiration rate? How fast you're breathing? Goes up. Do you know that inside your lungs, the bronchioles, the tubes that go down in your lungs, they dilate, they open up. So I can get more air, more oxygen into my bloodstream. So if I need to move or run or fight or flee or whatever, that I can do it because I have more air. What else? You ever notice anything about your mouth? You get like dry mouth, right? Your salivary glands start producing a more chalky, viscous type of saliva, not a digesting food type of saliva. Your gastrointestinal tract, the motility of your GI tract actually slows down or ceases. You don't want to poop or pee when you're like running from a saber-toothed tiger. Well, those aren't really our stresses these days, but just they're more like, stresses and papers and, relationship things and family and school and work and blah, 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 all these crazy things going on, right? And fires and classes canceled and uncertainty of all that. So it's stressful. So not saber-toothed tigers, but they're replaced with all these equally stressful things, right, that your brain takes in and heightens that part of your nervous system. So your sympathetic nervous system is responding to all that. By activating the adrenal medulla, you're telling the medulla, your brain is telling the medulla, okay, start dumping out noradrenaline, norepinephrine, so that it can circulate around the bloodstream and act as a hormone, okay? So it's sympathetic nervous system, but now you've activated your endocrine part of your adrenal medulla, and now you have that hormone surging through your body. I will say that norepinephrine and epinephrine are also neurotransmitters. So there are neurotransmitters that are released in your brain, and they're released at different neurons and nerves. And they're part of the sympathetic nervous system. But released by the medulla, they're actually a hormone. Okay? So they circulate in the blood and they act on target cells and tissues, and they serve this dual function of both neurotransmitter and then here as a hormone. So the hormonal effects last 10 times longer than just the neurotransmitter effects and activating the nervous system. Once you engage the adrenal medulla, those effects can be 10 times as long. Okay? So heightened respiration rate, sweating, different saliva, eyes, iris, pupil dilates more air down into the lungs, all those things happen. Okay? So another element, and we talked about this a little bit when we talked about anthropometric and vitals measurements in lab. I talked about cardiac output and stroke volume of the heart. Basically, it's the heart, cardiac output is how much blood is the heart putting out per minute, okay? Stands for CO, cardiac, R-I-A-C, output. Cardiac output refers to how much blood is being ejected by the heart per minute, specifically the heart, okay? And if you are healthy and you have good cardiovascular fitness, your heart has a higher cardiac output. So remember, I sort of already taught you guys, we talked about this in lab, talking about the heart and the heart rate, we did the heart monitors and blood pressure. If someone is very athletic or cardiovascular fitness is very good, they tend to have a lower, resting heart rate is lower. It can be 50, 60, really low, lower than the average. Because, we all kind of talked about this, and many of you wrote this in your discussion questions, and on the test, if the person is healthier or has better cardiovascular fitness, their heart doesn't have to work as hard, right? You kind of use that, heart doesn't have to work as hard with every single beat. It's very efficient, it gets the blood out. The real reason for it is their cardiac output. That is exactly true, that's what it is. Their heart muscle fibers are stronger. And so with every single pump, they get more blood out. So per minute, they have a better cardiac output. Doesn't have to beat as fast to get that much blood out to the rest of the body. For everybody, regardless of your cardiovascular fitness or not, if you experience a lot of stress and it hits you, your body will respond by increasing cardiac output. How much blood my heart is putting out per minute, okay? So it'll be stronger, more forceful contractions, and it'll be faster to get more of that blood out to my tissues of my body. my respiratory rate will go up, mental alertness actually goes up, so you're hyper aware of all kinds of stuff. Maybe not certain things, you'll select your attention, but you will be sort of hyper alert, okay? Coronary blood vessels dilate, so the blood vessels serving the heart will actually open up so you get more blood to the actual heart itself, and your metabolic rates will actually go up. So you'll start consuming and burning more metabolic pathways and kind of ramping everything up. You get hotter, you get sweaty, right? All those things go up. And this is all focusing through the adrenal medulla. Okay, so stress in the adrenal gland, we're going to talk more about this when we get to the end of the course and we talk more about sympathetic and parasympathetic nervous system, what stress does to your system over time and how to curb or manage stress in different ways. We'll talk a lot more about that later. So I just want to kind of introduce it now. Stress will increase the secretion of ACTH. Who can tell me what ACTH is? ACTH comes from the anterior pituitary. It's one of the 7 major hormones we talked about. Adrenocorticotropic hormone. Adrenocorticotropic, now let me think about it. Adrenocorticotropic hormone causes the release of what? Cortisol, the adrenal cortex hormones. So this specifically, the brain goes, okay, active pituitary, go. Anterior pituitary releases this. This results in increased glucocorticoid release coming from the adrenal cortex, okay? So we're going back to the medulla and looking at what's happening there. Stress hormones in general will activate your entire adrenals, the cortex and the medulla, which means you're going to start pumping out mineralocorticoids, glucocorticoids like cortisol, adrenal androgens, and your medulla actually from the nerves coming down as part of the sympathetic nervous system are going to tell the medulla go as well. The medulla is going to start cranking out norepinephrine. So you're in epinephrine. So you're going to have glucocorticoids like cortisol, epinephrine, and CRH is another one that are now in your bloodstream circulating. CRH is corticotropin releasing hormone. Okay? Corticotropin releasing hormone, or CRH, is actually the one that comes from the hypothalamus. So the boss, I'll just put hypo, comes from the hypothalamus. That triggers the release of ACTH from the anterior pituitary, and then that triggers the release of cortisol, glucocorticoids. So the hypothalamus is the one that triggers CRH release, and then it triggers the pituitary release ACTH, which then causes cortisol to start dumping out. And your nervous system is also telling the medulla, okay, start pumping out epinephrine, adrenaline. So this is all part of this process. If you have stress for a period of time, we would refer to this as general adaptation syndrome, or GAS. Like you're getting gassed. Okay, your body is exhausted, it's exerting itself, it's trying to deal with stress, and it deals with it in this way, the general adaptation syndrome. Really, it's good for proper recovery after stress. So when you have any kind of illness or trauma, whether it's physical or mental, psychological, your body is dealing with it in this way, with these hormones, with this response. So you can have enough fuel, you can increase your metabolic rates, you can get through what you need to get through. Okay, so really physiologically it's a good thing. Cortisol helps to inhibit your immune system, specifically your white blood cells, so that your immune system doesn't over-respond to any of these stressors or traumas or incidents or illnesses, right? So it doesn't over-respond. This can be a bad thing though, right? Okay, so this is your body's way of kind of dealing with the stress and getting through it and helping you heal and kind of inhibit this over-response, but it can be a bad thing if it continues. Okay, so chronic stress, of course, we've mentioned this already, has an increased risk of illness, okay? Cortisol acts on higher brain regions. So higher brain regions meaning your cortex, parts of your brain that are involved in emotion and memory and recall and talking and thinking and remembering and understanding, all the parts of your brain that are involved in all that higher processing stuff. Cortisol acts on a lot of those brain regions. It actually, extended elevated cortisol levels can actually be linked or cause depression, anxiety, and memory problems. So things like dementia or forgetfulness, that a lot of times when there's a lot of stress, a lot of chronic stress, people will have mood and anxiety disorders. and have problems recalling things or memory deficits. So by stimulating the liver to release glucose, what happens is, so the liver is releasing lots of glucose because the liver stores glycogen, right? And the muscles in the liver store glycogen. And here's a big liver, we can see right on this. The liver also is involved in sugar regulation because they get released. Here's the big giant liver. Stomach is right here. Liver's off to the right, so it's on the right side of your abdomen. This has massive stores of glycogen. Glycogen, when sugar levels go low, the liver will actually start releasing glycogen broken down into glucose. So you have a lot of glucose now circulating throughout your body. Okay? So the liver has a role in sort of glucose or sugar regulation as well. So insulin receptors, over time, what happens is if you have a lot of chronic stress and your body is dumping out with cortisol and your liver is saying, okay, dump out, break down all the glycogen, free up all the glucose, your body is getting exposed to lots of insulin, right? Because high sugar triggers the release of insulin from pancreas, right? So now your body is seeing a lot of insulin, a lot of sugar. Insulin receptors can start to become resistant. If you're bombarding any of your cells with a particular hormone over time, that receptor for that hormone on those cells can start to get desensitized. It's almost like too much binding and activating that response over and over. So the receptors start to, there's different things that happen. They get down-regulated, so there's less of them, or they get faulty and they cannot respond. So even though the insulin is there and it's binding and it's saying, okay, take up the sugar, they can't respond as well because they've been bombarded with too much of that hormone over time. So in chronic stress, you start to have sugar metabolism problems, insulin-resistant problems, and you can see that it ultimately, if someone has diabetes, it becomes way harder to treat somebody with diabetes and stress, that combination, because they're getting blasted with sugar, blasted with insulin, blasted with sugar, blasted with insulin. So even when you give them medications to make them more sensitive to the insulin response, it's harder when someone has chronic stress. So this is a diagram that sort of summarizes, there's a lot going on here, but it summarizes these two different responses that are happening with the adrenal glands and stress. So if we look first on the short term, this is kind of the short-term response. This would be the sympathetic nervous system, fight or flight. Real quick, I hear a loud sound. You guys ever heard like a loud sound, like a gun go off or something, right? You kind of like flinch, you do that whole, and your whole body gets kind of activated, you get nervous, you get jittery, you get shaky, you're breathing fast, heart rate goes up. This is all part of the nerve impulses coming from the hypothalamus. Stress, your eyeballs, your ears took in information, activate hypothalamus, tells through a series of neurons that go down, activate the adrenal medulla, start dumping out epinephrine. Lots of epinephrine, also some norepinephrine, get dumped into the bloodstream. So now you get increased heart rate, increased blood pressure, liver is chomping down glycogen into glucose, releasing it into the blood, dilation of the lung, bronchioles, changes in blood flow, so less blood to the GI tract and more blood to the skeletal muscles, increase in metabolic rate, so everything ramps up, everything's speeding up. This is seconds to minutes, okay? But if I have extended or more prolonged stress, not just hearing a loud shot or hearing something or being temporarily stressed out, more like stress that's kind of nonstop and ongoing, more like a chronic or prolonged stressful situation, that's when your hypothalamus and your endocrine system actually gets involved. Not just releasing those from the adrenal medulla, but now the cortex, the adrenal cortex is becoming involved. And you're still dumping out lots of epinephrine, but on top of that, your hypothalamus is releasing corticotropin-releasing hormone, or CRH, okay, from here, telling the pituitary specific cells of the pituitary that make ACTH to start releasing ACTH. So it's a whole triggering response. Stress, stress, stress coming in, CRH dumps into the capillaries that travel to the pituitary, it starts releasing ACTH, that travels in the blood, now it tells the adrenal cortex to start pumping out glucocorticoids and mineralocorticoids. So aldosterone, cortisol, now you've got those supplementing other hormones that are already in your bloodstream. So now you have cortisol go up, you have aldosterone go up. This is your body's response to dealing with long-term stress, okay? So ultimately, things like aldosterone cause your kidneys to hang on to sodium, salt, hang on to potassium, hang on to salt, and water. So your kidneys, instead of letting them go, they go, oh, we got to hang on to the salts, we got to hang on to the water. Well, if I hang on to the salt, the water will follow the salt, because by osmosis, that's what water does. So if my kidneys now are going, ooh, hang on to the salt, don't let it go. Water will naturally go and follow back into the salt. Okay, so now in my bloodstream, I have more salt, I have more water. Ultimately, my blood volume goes up. If my volume in my series of tubes that make up my blood vessels, if the volume in there goes up, what happens to the pressure? It goes up. I've got the same tubes, right, the same amount of space. If I have more fluid than I'm retaining, my blood pressure is actually going to go up, okay? So aldosterone, this is one of the main ones that does that, aldosterone. It's a mineralocorticoid. Tells your kidneys hang on to the salt, hang on to the sodium. It also leads to tightening or vasoconstriction of the blood vessels. So it will even clamp down your blood vessels. Hang on to the salt, hang on to the water by the kidneys, and clamp down your blood vessels or vasoconstrict them. Cortisol, on the other hand, causes proteins and fats to be converted to glucose. Remember, there's a word for that. When you use other types of fuels, your cells start using other types of fuels and converts them into glucose. Do you remember that word? Genesis, birth of new sugar. Your body starts using other fuels, other macromolecules, and turning them into glucose. Gluconeogenesis for energy. To make sure that you have tons of glucose available for your brain and your body. So you get increased blood glucose levels, and then ultimately, it's small, it's hard to see, but suppression of the immune system. Cortisol increases blood sugar levels, increases gluconeogenesis, and ultimately suppresses your immune system. Okay? It's preventing it from being hyperactive or overactive. But ultimately what this leads to is, you can see, short term, seconds to minutes, hours to days to months to years. This has a chronic effect. These hormone levels have a chronic effect on your body and your chance for getting different illnesses. Yes? And actually, this general adaptation syndrome, we summarize sort of right here, is GAS, or general adaptation syndrome. If this goes on indefinitely for years, it can result in death. So people can actually die of stress and the illnesses that come along with it. So it is a really important factor when we talk about the endocrine system and all the control that the hormones have. So there are some stress in the adrenal gland. There's all kinds of stressors. Your cerebral cortex is taking in all the stimuli, routing it to the hypothalamus. The hypothalamus is triggering the pituitary, which is triggering all these other glands, especially the adrenal glands, right? And it ultimately has effects on your immune cells, your white blood cells, your thyroid gland, your thymus, your bone marrow, which makes blood cells, which makes your red blood cells. And this one actually goes over the effects of alcohol. Alcohol, too much alcohol in the system starts to affect the liver. It secretes factors, cytokines, that actually affect the brain over time so it's another type of sort of exogenous stimuli that can lead to damaging the brain and parts of the body. So stressors and things like alcohol, that's a little diagram that shows a lot of the negative effects of those. So negative feedback is a really important part of the endocrine system. So negative feedback or negative feedback inhibition. I went over the example, and on a lot of your cards you said I got that. I got thyroid hormones and negative feedback of thyroid hormone pathway. And for example, how a goiter develops, right? If you don't have enough iodine, you don't make enough T3, T4, you don't have this, then you lose that negative feedback, right? So you get thyroid stimulating hormone just pumping out, and it makes the thyroid hypertrophy. But all of these different hormones have negative feedback. That is how the brain, hypothalamus, and the pituitary, and the different endocrine glands, they can all work together to carry out their function. You don't want to be blasted with any specific hormone. You want just enough to have the response, and then you want to shut it off until you need it. And then it comes back on. So it has to operate. You have to have checks and balances. It's like the government, which is kind of laughable right now. But there has to be checks and balances, right? You can't have just one thing going all the time. You have to be able to shut it down. Turn it off when I need it, shut it down when I don't. So the example of this for the stress hormones, you have non-specific stressors coming in, just lots of stress, affecting higher brain centers. Those send neurons that activate the hypothalamus. That releases CRH, or corticotropin releasing hormone. That triggers the anterior pituitary cells, the specific cells there, to release ACTH. ACTH tells the adrenal cortex, okay, go, start dumping out your cortisol. Over time, though, what will happen is you'll have little peaks and troughs. Instead of just being blasted and having cortisol, 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 it has negative feedback, inhibition on the pituitary and on the brain. This negative feedback and this minus sign is saying that it actually inhibits the pituitary from releasing ACTH and inhibits the hypothalamus from releasing CRH. So it'll temporarily slow it down, shut it down, okay? But then with more stress, it'll make more cortisol. And then more cortisol will negatively feedback and slow it down. But if it never ceases, this will keep going, right? It'll keep shutting it down and turning it back off. So a lot of times what we'll see in highly stressed, chronically stressed individuals is cortisol levels go real high and then they come down. They go up and down. They keep going up and down, okay? Because your endocrine system has this beautiful set of checks and balances or negative feedback inhibition so that your hormones are not just always at really high levels. But again, it will keep getting produced if you keep getting the exposures. Okay, so there are some different disorders. A couple of these really interesting disorders of the adrenal gland. I will say stress and the general adaptation syndrome is not really a disorder. It's more like a physiological effect of being impacted by too much stress. And your adrenal glands are doing what they're supposed to do. They're doing what they're supposed to do. The medulla and the adrenal cortex are trying to mediate and deal with this situation and the stress and make sure that you have enough fuel and sugar and responses to survive. But the actual diseases of the adrenal glands are affected by imbalanced hormones of adrenal cortex and medulla hormones. So Cushing syndrome is one of them, and it's caused by too much glucocorticoids or cortisol. So high levels of cortisol are being made by the adrenal cortex, okay? Usually this is a result of a pituitary tumor, okay? And it's a pituitary tumor. Just take a guess which lobe of the pituitary is probably affected here. If I'm having too much cortisol, this individual's having too much cortisol being made, which part of the lobe of the pituitary do you think has the tumor? The anterior pituitary, specifically the cells that make ACTH, adrenal corticotropic hormone, and they're making too much of that hormone, and that's going through your blood and telling the adrenal cortex, okay, dump out cortisol. Inappropriately dump out cortisol, like not at the right time, just because there's too much ACTH coming from a tumor. So this causes weight gain on the trunk, something we call fat pads. There's certain fat pads in certain locations of the body. Moon face, the face gets very dilated with capillaries and pink, so there's a rosiness to the face. Buffalo hump, I did not make these things up. These are what they sort of say these characteristics are. Buffalo hump is an accumulation of a fat pad on the back of the neck, the back of the cervical vertebrae, and it almost looks like a hump sort of right on the back. Causes thinning of the skin. So over time, protein and fat is being converted into sugar, right? So if I'm breaking down body proteins and converting them into sugar, I'm actually wasting away and using some of the protein of my skin and of my connective tissues. Those are being broken down. So it causes a thinning of the skin, which ultimately ends up causing striae, or very extreme stretch marks. So not just the normal little light stretch marks, but very colored, thick stretch marks because of the breaking down of the skin. Now notice this is all from just too much cortisol. It's almost like a heightened stress response, but we get to see the effects on the body in this particular syndrome, or Cushing's syndrome. Addison's disease is very rare. This is also pretty rare. Addison's disease is even more rare, and this is the opposite of Cushing syndrome. This is where there's a hyposecretion of the adrenal cortex. Hyposecretion means what? Not enough, right? So secretion is too low. So not being able to release the mineralocorticoids, the cortisol, those are too low. So this is the opposite of Cushing syndrome. So there ends up being deficiencies of mineralocorticoids and deficiencies of glucocorticoids, like cortisol. So there's not that normal sort of response. And there's not enough of aldosterone. So ultimately it leads to fatigue, weakness, weight loss, so there's body weight loss, mood changes, hyperpigmentation, so there's hyperpigmentation a lot of times in the gums and the skin, different parts of the body. There's just not enough mineralocorticoids and glucocorticoids to mediate stress responses and allow normal physiology of the body. There's a picture in your textbook of another woman, but this is very similar. In your book, I think it was before with the disease with Cushing's and then after treatment, because you can medically treat. Usually the pituitary can be removed, the tumor in the pituitary can be removed very carefully, and with treatment you can reverse it. This is the patient before the onset of Cushing's syndrome, and then this is just a couple years later after getting the symptoms and actually showing full-fledged Cushing's syndrome characteristics. She's starting to get the buffalo hump, wider face, sort of the moon face. There's also other features of Cushing's, and this is more just illustrating some of the fat pads that develop, so thinning of the skin and the limbs tend to get thinner, although fat accumulates in the abdominal section. That thin skin usually leads to really excessive striae or stretch marks. This is not like just from growing, the normal sort of stretch marks that many people get, the striae due to growing or gaining weight. It's a little more extreme than that. So a lot of times going along with this, there's a loss of menstrual cycle, so there's infertility, high blood pressure, type 2 diabetes, low ferritin, which is what carries iron in the blood, low vitamin D, low estradiol, FSH, LH, these are the gonadotropin reproductive hormones that regulate the reproductive system, fatigue, insomnia, loss of libido, difficulty getting enough blood. So there's all kinds of things that go along with this. So this is really just hypersecretion of cortisol, massive amounts of cortisol affecting the body over time, months to years. The other syndrome that's from not enough cortisol, not enough aldosterone, is Addison's disease. And just an example here is there's hyperpigmentation of the gums. So there's abnormal sort of pigmentation, fatigue, weight loss, depressed mood that goes along with Addison's disease. Okay. So that's the adrenal gland, the adrenal medulla, and the cortex, and all the different types of physiology that those glands actually, or that one gland regulates. You have two of them. But the next part, this is the endocrine gland that's called the pineal gland. The pineal gland is actually this little structure that's right here. So here's the hypothalamus, here's the pituitary, hypothalamus. The pineal gland is the structure that's right back. So here's pituitary. Here's hypothalamus, we've been talking about. Here's the pineal gland, it's right back in the back. It's like a little pine cone, pineal. It's like a little mini pine cone sort of structure, a little cute little oblong structure in the back. The whole job of the pineal gland, for the most part, is to secrete melatonin, okay? Not to be confused with melanin. Melanin is a pigment in skin that gives us color, various shades of yellow, brown, black, right? Not melanin, melatonin, okay? So this is a hormone that's made from the pineal gland. It's regulated by the hypothalamus, so the hypothalamus actually has tracts it communicates with that ultimately go to the pineal gland. And it stimulates, the hypothalamus stimulates melatonin production when it gets dark, okay? So when there's no light outside or it gets dark, it stimulates melatonin to be produced